Hello and welcome. Today we have some great information for everybody. This is Kendall Holcomb from the Resilience Project, and it is an amazing effort put together in a very short amount of time, Kendall.
Yes.
But we're going to talk to you a little bit more about it. So, Kendall, you are the Public Information Officer, and you are with Health and Human Services here for the state of Nevada?
Yes, specifically under the Division of Public and Behavioral Health.
Excellent. So tell me about the Resilience Project. What exactly is the Resilience Project?
Sure. So the Nevada Resilience Project actually came about in response to COVID-19 specifically. It was really an effort to address the mental and emotional impacts that Nevadans are facing because of COVID. So we're seeing a lot of people who are dealing with stress, obviously depression, anxiety, to a degree kind of never seen before. Actually, according to the CDC, Nevadans are seeing 3 to 4 times more anxiety or depression than before the pandemic itself. So our program came about to really address those needs on very grassroots, organic level by using people within their own community to be kind of a sounding board to provide coping skills, stress management opportunities, and then also to provide warm handoffs if somebody needs additional services beyond what our resilience ambassadors can provide.
Oh, that's amazing. So how exactly is all of this funded?
So our program actually came about as a crisis counseling training and assistance grant, say that 3 times fast, specifically through SAMHSA, which is the Substance Abuse and Mental Health Services Administration, as well as with FEMA, so the Federal Emergency Management Agency. Nevada is one of several states that actually have received this grant, and so that grant was awarded back in June and is slated to run through May of next year.
That's amazing because there's so much of a need for this. So
Yes.
Do you also have ambassadors that can reach people that don't speak English?
We do. We have several ambassadors throughout the entire state, 39 total by region, several of which are bilingual, so in English and Spanish, and then we actually also have some that speak Tagalog, Italian,
Wow.
Different things like that, and they can be sent or put in contact with somebody who requires that additional communication assistance.
That's amazing, unbelievable, wonderful job. So I think you kind of touched on this earlier, but what other mental health needs are you seeing in our community?
So the way our program is set up is specifically by region, and then also we have ambassadors with Crisis Support Services Nevada, as well as with Nevada CANS, which is our COVID aging network for seniors. So depending on where that region is kind of where we're seeing different needs. We also work with the Boys and Girls Clubs across the state. So for our youth, we're seeing really a lot of questions and anxiety and depression and concerns for our youth because this is something that they don't know. They don't know how to deal with this. They are dealing with distance learning for the first time. So they're really trying to figure out how to mentally and emotionally cope with that. And then for our seniors, because they are a vulnerable population, they obviously can't spend time with family or friends like they're used to. So we're seeing a lot of issues with isolation or anxiety. And then the general population, just with COVID going on, we're all dealing with stressors that we never thought we would. And so figuring out how to deal with what is our temporary normal. I'm not saying the new normal because I firmly believe that things will get better.
Right.
So we're just adapting as we go.
Exactly. It's a little bit of a trigger for a lot of people.
Yes,
I can understand
it is.
that. But the reality is we're here for a little bit, but you're right, it's temporary.
Yes.
You'd mentioned something I think is very important, and we had Dr. Cotton on earlier, and we talked a little bit about what's going on in the high schools when kids are not in school for it. It could be for any reason, but if it's an extended amount of time, it's automatically assumed that they have COVID, and then there's a lot of bullying around that. Have you been seeing that? Have your ambassadors been seeing that?
We've seen it a little bit. There's definitely a fear, I think, of if somebody coughs. It's, I don't have COVID, I just have, allergies or things like that. And so I think really we're trying to encourage the message of just resilience and understanding and community and recognizing that this is really not the time to be bullying or targeting people, but really trying to support them and embrace them.
Right. That's beautiful. So how does one get in contact with these amazing people and the resilience ambassadors?
So we actually have a website, NevadaResilienceProject.com. If you Google it, because I definitely have misspelled resilience before.
Yes, me too.
Right? It will come up. It's a sister site actually to Nevada 211. So if you get redirected to 211, it's still us. And we actually have a contact form on there, right under basically our mission statement that says contact a Nevada Resilience Ambassador.
Excellent.
We do ask for just very basic information because we are relatively anonymous and confidential, so we're not asking for your last name or anything like that. We're just asking for a first name, a way to contact you, and really what you're asking for from us. And then myself and a couple other state staff members monitor that because it gets sent to an email address. And then we can connect that individual or family with an ambassador in their region because we are statewide.
Excellent. Well, thank you so much for being here. I really appreciate it. And we'll include all of this information in the links below. Thank you so much for watching. COVID, your resource to everything related to this situation that we're in. COVID. We're going to have doctors, epidemiologists, and all kinds of experts answering your questions so that we can navigate this crazy world that we're in together with COVID. So please subscribe to the channel, follow us, and we'll make sense of this together.